Hello, dear students. I am Dr. Darshan Dave, and before starting the chemotherapy, which is a very important segment of the pharmacotherapy, we will first discuss the terminologies that we will commonly encounter while discussing the chemotherapy. And hence, the learning objective of the today's session is students should be able to first understand and then define the different terminologies in chemotherapy. So first I just enlist different terminologies. These are chemotherapy, antibiotic, antimicrobial agent, bacteriostatic action, bactericidal action, post-antibiotic effect, minimum inhibitory concentration or MIC, minimum bactericidal concentration or MBC, concentration dependent killing, time dependent killing, and last but not the least is chemoprophylaxis. Now we will discuss each terminology one by one. First is chemotherapy. Now before discussing this, many of us they are having a myth that chemotherapy means the treatment of cancer. Now it is not wrong, but at the same time it is not true also. I want to say that the treatment of the cancer and the agents that are used, they can definitely call it as cancer chemotherapy. But there are various other diseases for which we are using the agents that is also known as a part of chemotherapy. So chemotherapy means treatment of systemic infections. Now dear friends, what do you mean by systemic infections? It means that whenever any pathogenic microorganism, when it invades in our body, then there are two possibilities. Either our body's defense mechanism will kill that microorganism, or the pathogenicity is so much high, or the body's defense mechanism is not that much competent to deal with that organism, and that organism starts multiplying and then it produces an illness that is known as systemic infection. Okay, any pathology caused in our body because of the pathogenic microorganism. Say for example, Plasmodium falciparum and vivax, they causes malaria. Treponema pallidum, it causes syphilis. Mycobacterium tuberculosis causes tuberculosis. So, from this discussion, it is very clear that if we want to treat the systemic infection, we require a specific agents, specific in terms of they are having action only on this microorganism, and how these agents can treat the infection. Either these agents inhibit the growth of the microorganism, so the number of the pathogenic microorganisms will be less, and that can be dealt with the body's defense mechanism, or simply the agent can kill the microorganism. So chemotherapy means treatment of systemic infections with specific agents that selectively inhibit the growth or kill the microorganisms. But here one condition is must, because we have to kill the microorganism or inhibit the growth, but these are the living organisms, so agent should be such that they act on these type of living organism only, and not act on the body's normal healthy cells. Okay, so without significantly affecting the host. So now you just think That what is cancer? Cancer, it means that uncontrolled proliferation of the body's normal cell. Now here, for the management of the cancer, we have to give an agent that kill these abnormal cells, that kill this abnormal proliferation. And it is very difficult for any agent to identify the body's normal cell and the body's cells, but these are abnormal. And that's why the cancer chemotherapy has significant adverse effect. Okay, so I think it is clear. Now we go ahead. Second most commonly used terminology is antibiotic. Okay, you have heard this terminology before entering into the MBBS many a times. Antibiotic means the agents that are acting against microorganism, fine, but these are the agents that are derived from the microorganism. It means that agent is derived from a particular microorganism. Now microorganism can be of many types: bacteria, fungi, virus, parasites, hell means many more. So if the agent is derived from a particular microorganism and it's acting against another microorganism but at a lower concentration, and the classical example is the chance discovery of the most pioneer antibiotic group, and that is a beta-lactam antibiotic, that is penicillin. Is derived from the fungi Penicillin, notenum and chrysogenum. So penicillin is called antibiotic. Now the next is antimicrobial agent. So any agent, if we just look at the terminology, majority of the time the terminology gives you the answer only. Antimicrobial agent means the agents acting against the microorganism. Simple. Now it has nothing to do with the source, whether it is naturally derived, whether it is semi-synthetic, whether it is synthetic. So any type of the source, but if it acts on the microorganism, then it is known as an antimicrobial agent. So dear friends, antibiotics are the agents that are derived from the microorganisms, and there are many other agents which are semi-synthetic or synthetic in nature, but they also act against the microorganism, and collectively these all are known as an antimicrobial agent. So we can say that all the antibiotics are antimicrobial agent, but all the antimicrobial agents are not antibiotic, or in the mathematical term, antibiotic is a subset of antimicrobial agent. Now bacteriostatic action. Static means stasis. Stasis means just stagnant, no growth, no multiplication. So bacteriostatic action means inhibit the growth of microorganisms. Then bactericidal action. Cidal means to kill. So just killing of the microorganism is called the bactericidal action. Then post antibiotic effect. Here again, if you just look at the terminology carefully, the effect which is seen after the antibiotic, it means that once you have taken the antibiotic, it is absorbed, it enters into the systemic circulation, reaches the target site, then it is eliminated, it is not present in the target site, it is not present in the plasma, but still its action persists, and that is known as a post-antibiotic effect. So persistence of the antimicrobial action even after the removal of antimicrobial agent from the site of the action or from the plasma, and as it is very difficult to measure the antimicrobial agent concentration or any other drug at the site of the action, we generally measure it from the plasma. And the classical example is aminoglycoside antibiotics. They are having a very long post-antibiotic effect. And that's why even if its half-life is very less, but still it is effective if we give the drug once a day. Then the next term, minimum inhibitory concentration. As the name itself suggests, minimum amount of an antimicrobial agent in the plasma or minimum concentration of antimicrobial agent in the plasma that is required to inhibit the growth of microorganism. That's why it is known as a minimum inhibitory concentration. And similarly, minimum bactericidal concentration. It means that the concentration of the antimicrobial agent in the plasma, that minimum concentration that will kill the microorganism. So minimum inhibitory concentration and minimum bactericidal concentration. Now, a very important concept to understand, that killing of the microorganism by any antimicrobial agent, based on that killing, the antimicrobial agents are divided into the two types. One is the concentration dependent killing. It means that the certain antimicrobials follow the concentration dependent killing. And the other is time dependent killing. It means that the antimicrobial agents follows time dependent killing. Now, what do you mean by concentration dependent killing? It means that the killing of the microorganism will depend on the concentration of antimicrobial agent. It means that more the concentration, more will be the killing. And to make it more precise, more the peak plasma concentration of the antimicrobial agent, more will be the killing of microorganism. And even more precise, it is the ratio of the peak antimicrobial concentration in the plasma versus minimum inhibitory concentration will decide the killing of microorganism. And obviously the ratio will be more only and only if the peak will be more. And the peak will be more only if you administer the total daily dose in a single shot. So rather than giving the drug in a fractional dose, if you administer the total amount of the drug at a time as a single daily dose, then the peak will be more, then the effectiveness of the antimicrobial agent in terms of killing of a microorganism will be more. So, as I told you, this type of the drug should be administered as a single daily dose, and the classical example is aminoglycosides. Now, aminoglycosides are having multiple reasons why they should be administered once daily. In the previous slide, we have discussed these agents are having a very long post-antibiotic effect. One. Second, they follows the concentration dependent killing. And third, the toxicity. Aminoglycoside antibiotics are very effective against the microorganism, especially the gram-negative microorganisms. Many of them are responsible for serious infections. But the problem is nephrotoxicity and vestibulocochlear toxicities. And these toxicities are directly related to the persistent presence of antimicrobial agent at the target site. Now, if you administer the total daily dose in a single shot, then there is a time interval during which there is no presence of drug at the target site, and that's why the chances of development of adverse reactions to this organ will be less, and that's why aminoglycosides are best given as a single daily dose. We will discuss this more at the time of aminoglycoside antibiotics. Then the next is time dependent killing. It means that here the killing of the microorganism or the action of the antimicrobial agent. It depends on the time. Then which time? The time during which the antimicrobial concentration remains in the plasma above the minimum inhibitory concentration. Here the time period is effective. It has nothing to do with the peak plasma concentration. Here we just want that the drug remains in the plasma above the MIC for a longer period of time. And how this can be possible? You just think, if you administer the drug at a rather than a single dose, if you administer the drug in a fractional doses 2, 3 or even 4 times a day, then the total time period during which the antimicrobial concentration remains above the minimum inhibitory concentration will be more. So these type of agents that follows the time dependent killing, they should be administered in a fractional doses. That is one. And second, the classical example is, even though there are many antimicrobials, classical examples is penicillin. So here in the figure you can see that on the x-axis there is a time, on the y-axis there is a concentration, and you can see the peak concentration. Okay, if you administer the drug as a single daily dose, the peak will be more, and that's why the peak upon MIC will be more, and which is important in case of concentration dependent killing. Okay, while in case of time dependent killing, the time period during which the concentration of the antimicrobial agent remains above the MIC, that will important. So I think this figure will clear majority of your concepts regarding the type of the killing. The last is chemoprophylaxis. It is made up of, this term is made of two terms. Chemoprophylaxis, it means the chemo plus prophylaxis. Chemo means antimicrobial agent, and prophylaxis, you all know, prevention. So it literally means use of the antimicrobial agent for the prevention of infection. Then if I am using this term, that use of the antimicrobial agent for the prevention of infection, then it is a very vague statement, because there are n number of infections and any infections can occur to the any individual. The possibility is higher or lower, and that's why we cannot use the antimicrobial agent just randomly to, based on the hypothesis that okay, this infection may occur, so we use this antimicrobial agent. And unfortunately this type of the practice is more common nowadays, and this will lead to indiscriminate, irrational, prolonged use of antimicrobial agent, and there is a very clear relationship between the more you expose the antimicrobial agent, more will be the chances of resistance. And so it doesn't mean that we should not use the antimicrobial agent for the prophylaxis. No, there are certain definite conditions. There are specific risk group of the patient also, and for that we have to use the antimicrobial agent. So in short, there must be rational indication for chemoprophylaxis. Later on we will also discuss about the chemoprophylaxis, because it is a very important topic as far as the antimicrobial resistance, which is the most burning issue nowadays, is concerned. So here we add with the different terminologies in the chemotherapy. And if you have yet not subscribed to this channel, that is Pharmacology in Simplified Way by Dr. Darshan Dave, please subscribe it. And if you like this session, then please press a like button, and if you find it appropriate, keep sharing with your colleagues. Thanks a lot.